idle PPEs that are lying at the KEMSA warehouses. About 115,000 of them are still at the KEMSA warehouses stock, and they further say that they have stock worth about 5.9 billion shillings worth of goods in their store. So tonight the Ministry of Health is on the spot for dragging its feet in protecting the country's frontline workers. Kenya Medical Supplies Agency KEMSA is holding over 100,000 personal protective equipment when the number of frontline workers contracting the virus is rising by the day. KEMSA says it is yet to receive authority to sell off protective gears within its custody. This despite Health Cabinet Secretary Mutahi Kagwe claiming some 2 weeks ago that he had written to the authority giving the green light to sell the PPEs to protect the doctors fighting COVID-19. Samogena has more.
It is a puzzle of who is fooling who and at whose expense. While the country's frontline workers are up in arms over lack of protective gears, at the Senate it was a shocking admission that over 115,000 personal protective gear were lying idle at KEMSA stores. The admission coming nearly 2 weeks after Health Cabinet Secretary Mutahi Kagwe had told the same Senate Health Committee that he had written to KEMSA directing them to sell off the PPEs to ensure the country's health frontline workers are protected. But as it emerged, the minister was offering mere lip service.
I was made to understand that there was an instruction from the Ministry of Health that gave you authority to sell at the current market prices of those. That instruction has not reached you?
Chair, as of today morning, we have not received written instructions.
Appearing before the Senate last month, Mutahi told the Health Committee, quote, "I have written to KEMSA to allow the release of masks and PPEs at the current market rate instead of holding them," end of quote. Despite the verbal submission the health minister never relayed, the purported letter issuing such instructions, lack of protective kits forms part of the grievances by the health workers, some of whom are now on strike, while doctors having postponed theirs for 2 weeks.
We have a challenge when it comes to the clinical officers. Have you or have you not released the PPEs that you had been directed by the CS, albeit verbally, to be able to release?
We have not released them. We have not received the written instructions from the CS.
As the ping-pong plays out between Afya House and KEMSA, the country lost yet another doctor who supposedly contracted the virus in the line of duty.
There's no point of going back and forth. I think we end this meeting here. We call the CS and KEMSA together, because if we keep calling people different people all the time, we will never get to the bottom line of this.
The supplies agency being probed for flouting procurement laws in the over-procuring of protective kits has a stockpile of masks and PPEs worth 5.9 billion shillings in its warehouses. Out of the 5.9 billion shilling stockpile, EACC has frozen processing of the supplied kits worth 2.9 billion shillings. KEMSA is now forced to sell off the kits at market price that will occasion the supplies agency loss of millions of shillings. Samogena, Citizen TV, Nairobi.